welcome back to the Wellness Check. Today I wanted to talk to you about EMDR a little bit and what the term bilateral stimulation means and the many ways that we can use it with our patients, with our clients, depending on their needs and their preferences. As you know, I am an EMDR therapist. I also do Brainspotting. I am a trauma therapist by nature. So anytime I can get into limbic system therapies, I am there. And I love doing EMDR because there are so many different ways to get into it. And what I've noticed over the years is that some people prefer the bilateral stimulation portion of the EMDR to be done in certain ways. And sometimes other ways feel really uncomfortable or just not very natural. So I wanted to go over, just in case you were ever wondering what it's like, what does it feel like, what to expect. These are some options that you can talk about with your therapist. First, we need to talk about what is bilateral stimulation. That's a fancy, long way of saying the mechanism that makes EMDR work. It's the way that we stimulate your brain, the left hemisphere and the right hemisphere, to work simultaneously together. So when we're doing EMDR, we really set the stage. We go over what it is that you want to work on, what it is that you want to focus on, why are you coming to therapy? And any example could be maybe there are some current triggers or stressors that you're dealing with, or maybe there's a history of trauma that we need to address. So first we begin by making a target. Well, what is it that you want to focus on? And we really set out this template, this protocol together to zoom in and focus on even more how you wish to go about desensitizing this and reprocessing it. So once that protocol is done, then we go into what's called the desensitization phase. In EMDR, it stands for eye movement desensitization and reprocessing. Again, it's a mouthful. That's why we just call it EMDR. And the desensitization phase is one of the most important phases. It's one of the most lengthy phases where we're really sorting through the material that is bothersome to you. And in doing that, we incorporate what's called bilateral stimulation, using both hemispheres of the brain at the same time to really work through and process the material in a very different way, in a way that talk therapy cannot do it, in a way that thinking about it or dreaming about it cannot improve. Bilateral stimulation. Maybe the most common way to do it is with eye movements. It's the EM part of EMDR. So traditionally, when Francine Shapiro, the creator, the developer of EMDR, came across this as even something that can be used for trauma treatment, it started out with eye movement. So let's just imagine you're coming into therapy, you're coming to see an EMDR therapist. One possible way to do the trauma treatment is with the eye movement. I'm going to demonstrate what that looks like. I tend to kind of get out of the way a little bit, especially when it's virtual. That way you're not looking straight at my face. But even if you're in my office, I tend to scoot over a little bit and give you a clear, straightforward path. And what you do is you would watch my fingers just like this, and I pan from side to side. Okay? So that's all it is. And while you're doing this, you're keeping your head still. You don't want to go from side to side because that can maybe make you a little dizzy. You keep your head still and you're simply tracking with your eyes. So your EMDR therapist will do a few passes of this. And as you're watching with your eyes, you're thinking about the specific target at hand. You're thinking about the memory, the emotions involved with that memory, the negative belief system that's connected to that memory, and your brain is going to start to reprocess those events and desensitize it in a way that brings the activation and the emotion way, way, way down. And anybody that's done EMDR knows exactly what I'm talking about. It's an amazing thing. Some people do not like the eye movements. Maybe they get really distracted. Maybe someone is prone to migraines or for some reason there's a medical situation in which their eyes cannot track that quickly, or there just might be just some discomfort with it altogether. There are alternatives that are equally as amazing, and I want to share those with you today. I have here a set of TheraTappers. So if you've gone to EMDR therapy, your EMDR therapist might have a set of these. I love TheraTappers. When I'm getting EMDR done to me, this is maybe one of my preferred ways to go about it. What this is, it might look like a scary contraption, but it's really not. It's very calming and it's a beautiful thing. And if you are getting your EMDR treatment done, you, the client, will be holding on to these two paddles. And these paddles, when turned on from this box that the therapist is holding, they begin to vibrate, and you'll feel it alternate left, right, left, right. Now, your therapist can control the speed, the intensity, and how long the sets are, which comes in very handy. And any skilled EMDR therapist will know what that intensity needs to be, how long the set needs to be. But basically you be sitting there, again, thinking of the protocol, the trauma treatment protocol, and you would be either with your eyes opened or closed, feeling the sensation of the left and right, which is the same thing as bilateral stimulation of watching the fingers. Here are some other options. If you don't like the eye movements and your therapist does not have TheraTappers, there are a couple different other ways that you can do this on your own, and this is what comes in really handy when doing virtual or telehealth EMDR, because you won't be able to have access to the TheraTapper. This is just for the professional, for the trained EMDR clinician. So another one of my favorite things to do is to teach people how to do the butterfly hug. Now, you can do it like this, crossing your wrists over and grabbing your arms or your shoulders or anything that's just kind of crossed. Some people like to make the bird and bring it over their clavicles. And what you do is it's the same thing. You're bringing to mind the trauma protocol that we have set up and agreed to do together for this desensitization phase. And with your eyes opened or closed, you begin to tap. So if you haven't noticed, there's a pattern here. Anything that stimulates your body on the left side and on the right side elicits bilateral stimulation. This is a super good option to use if you're doing virtual or if your therapist does not have TheraTappers. Butterfly hug. Now, another way to do it, let's just say that feels claustrophobic. To some people, this feels like a warm embrace, and that is what they need in the time of their trauma treatment. With EMDR, this feels comforting. But to some patients, to some clients, that actually feels pretty constricting and might actually increase anxiety. So that's when I invite people to engage in knee taps. So imagine your knees being right at the bottom of this screen. Same exact situation. We're framed and focused for the trauma protocol that we've set up. Now you can close your eyes or keep them open and you tap the tops of your knees. Just like that. All of it is the same. All of it is doing bilateral stimulation. And I think it's really beautiful that we can offer lots of different types of ways of doing it, because not everybody's the same. Different people have different comfort levels with how they're processing their pain. And to be able to find the right fit is really important. So I just wanted to share that with you. If you're ever working with your EMDR therapist, or you're even thinking about EMDR treatment, there are many options, and there's an option that will fit exactly what you need to make you feel the most safe and the most comfortable that you possibly can while doing the really hard and healing work. Okay, well, if you have any questions, I'd love to hear about it. I love talking about EMDR and Brainspotting. If you haven't noticed, I'm more than happy to answer questions. Thank you for checking in with your wellness today. I hope you have a wonderful rest of your day, and I'll see you soon.